Let me tell you about an illustrative scenario that I keep coming back to. A patient, I'll call him James, 69, retired firefighter, came to my counter. He had his blood pressure log in hand, 6 months of readings. And every single week par, the numbers were a little higher. His cardiologist had already added a third medication, a third. And James was doing everything right. Low sodium, daily walks, no alcohol.
He wasn't skipping doses. He was a model patient. But nobody had looked at what was sitting on his nightstand.
The medications quietly raising James's blood pressure were the ones he thought were completely unrelated to his heart.
Today, I want to walk you through 5 common medications that may be silently working against your blood pressure, fever, without anyone realizing it. Stay with me, because number 1 on this list is something most seniors take every single day without a second thought. As a geriatric pharmacist, one of the most frustrating things I see is a senior managing hypertension for years, doing everything right pote, and the numbers keep climbing.
When I look at their complete medication list, every prescription, every over-the-counter drug, every supplement, I almost always find at least one culprit. Here's the thing, your body after 60 processes medications differently than it did at 40. Your kidneys filter more slowly. Your vascular system is less flexible.
That means certain medications that were manageable decades ago can now have an outsized effect on your blood pressure.
The 5 I'm going to show you today are not obscure drugs. They are in millions of medicine cabinets right now, new, some sold without a prescription.
Let's start with number 5. Medication number 5. Over-the-counter decongestants. The ones you reach for when you have a stuffy nose.
Pseudoephedrine, phenylephrine, the names on the back of cold and sinus boxes. Here's what most people don't know. Decongestants work by constricting blood vessels in your nasal passages to reduce swelling. That's how they open your airways. But they don't just constrict vessels in your nose. They constrict vessels throughout your body, including the ones your heart depends on.
Research in geriatric pharmacology consistently suggests that pseudoephedrine can raise systolic blood pressure by 5 to 10 points.
In someone already managing hypertension, that effect may be significantly more pronounced. And because these are sold over-the-counter Helene, most seniors never mention them to their doctor.
What I tell my patients, if your blood pressure is being managed, please check with your pharmacist before reaching for a cold remedy. There are antihistamine-based alternatives that don't carry the same vascular effect. That's a conversation worth having at K before your next box of sinus pills. Number 4, non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, the medications people reach for after a long walk or an aching knee. The mechanism here is one of the most important things I explain at my counter, and most people have never heard it.
Your kidneys produce substances called prostaglandins. These help regulate blood flow to the kidneys' cool and how your body excretes sodium. First, your kidneys retain more sodium, which pulls water into your bloodstream, increasing blood volume. Second, your blood vessels lose natural flexibility. NSAIDs block prostaglandins. When that happens, 2 things occur, and both of them raise your blood pressure.
There's something else. If you're already taking an ACE inhibitor or a diuretic TONS, NSAIDs can directly interfere with how those medications work.
You may be paying for a blood pressure medication that's being partially blocked by the pill you took for your knee 3 hours earlier.
I'm not saying avoid pain relief. I'm saying your pharmacist can help you find an approach that doesn't create a competing effect on your blood pressure. Number 3 p.m. And I want to address this one carefully because I know this category carries a lot of weight. Certain antidepressants, specifically SNRIs, the serotonin and norepinephrine reuptake inhibitors.
Medications like venlafaxine, duloxetine, desvenlafaxine. These are prescribed for depression, anxiety, nerve pain, fibromyalgia.
Many seniors take them for legitimate and important reasons. And I want to be clear, I am not telling you to stop taking yours.
What I am telling you is this: SNRIs increase norepinephrine activity in your body. Norepinephrine is a hormone that causes blood vessels to constrict.
For some patients, that effect is small. For others, particularly those already managing hypertension, it may shift readings meaningfully upward.
Research consistently suggests that blood pressure monitoring should be part of routine follow-up for seniors on SNRIs. If yours hasn't been discussed,
it may be relevant, it may not. But connecting those dots is exactly what your pharmacist is trained to help you do. What I tell my patients, if you started an SNRI in the last 6 to 12 months and your blood pressure has been changing COV, bring that timeline to your doctor's attention. Number 2 may be the one that surprises you most. Licorice root. In supplements containing glycyrrhizin, PRU, the active compound in real licorice. I know what you're thinking. Licorice? That's not a medication. And that's exactly the problem.
Glycyrrhizin, found in licorice root extract and many supplements marketed for digestive health, behaves in the body like a mineralocorticoid.
In practical terms, it tells your kidneys to retain sodium and excrete potassium, the same effect, roughly, as having elevated aldosterone. And when your body retains sodium, your blood pressure goes up. What makes this tricky is where this compound shows up: herbal teas, digestive supplements, adrenal support formulas, some licorice-flavored candies imported from Europe.
Because it's natural, most people don't think to mention it at the pharmacy counter. But natural does not mean neutral.
Research consistently suggests that regular consumption of glycyrrhizin-containing products can raise blood pressure by a clinically meaningful.
If you take any supplement with licorice root extract listed as an ingredient, bring the bottle to your pharmacist. Let us look at the label. That's what we're here for. And now we come to number 1. Number 1 isn't a single medication. It's a pattern. A pattern I see in roughly 1 out of every 3 seniors who come to my counter with uncontrolled hypertension. Number 1, the combination. 2 or more of the medications I've described ABCABD taken simultaneously, without anyone in your care team having mapped how they interact in the context of your blood pressure. And when I show it to them, the reaction is almost always the same. I had no idea these were connected.
A decongestant for the cold, an ibuprofen for the knee, an antidepressant for the nerve pain. None of them flagged as a blood pressure concern. Individually, each one might shift your readings by a few points. Together, in a body after 60 already managing hypertension, the cumulative effect can be significant.
And the tragedy is that the solution is often simple. Right, once someone maps the full picture. James Pell, the retired firefighter I told you about at the start, was taking a nasal decongestant for allergies and ibuprofen for his shoulder. Neither had been connected to his blood pressure in any conversation with any of his providers. We worked through alternatives for both. His readings came down meaningfully within 3 weeks, without a 4th medication.
Ask specifically, are any of these known to affect blood pressure? That's a question any pharmacist can help you answer. It takes 10 minutes.
Bring that list to your pharmacist. Not just what you've been prescribed. Everything.
Because you now know something that most people your age don't. You know that blood pressure isn't just about salt and stress. And it's exactly what we're trained for. The knowledge you leave with today gives you the power to ask a better question. It's about what you're putting into your body every day for our eyes, and whether anyone has looked at the full picture.